impetus to begin such a center was a profound desire to make sure that we were comprehensively tracking the outcomes of our patients, trying to assess the cost of all the care that we provide, and ultimately improving the value that we deliver. The CNOC, as we call it, is composed of many kinds of researchers. The vast majority of them are interested in clinical outcomes, and we have an educational mission, so we work a lot with the medical school and the School of Public Health to work with people that are in training to bring their skills up to a level where they can become useful knowledge creators. We also work with physicians in training, so what we call residents, to help them guide questions, formulate hypotheses, and carry out a study. And we also work very closely with all the faculty here at the Brigham. And one of our goals is to eliminate all the barriers that typically are presented to any individual researcher when they approach a clinical question.
So in medicine, we really don't know how our patients are doing until we see them back in their follow-up appointment. Sometimes that can be a month, sometimes it can be 3 months. But in that entire time period, we actually don't know how they're doing. And when they're in our office, we see them for 10 minutes, and they're supposed to tell us everything that troubled them over the past 3 months in that time period. That's not only ridiculous, it's unfair to your patients. And so this is why we want to reach out and get their outcomes on a daily basis in the least obstructive way to their lifestyle. That way, if there are corrections that we can make, we should be making them on an ongoing basis to make our patients' lives better throughout that time period.
We track the patients in a couple of different very important ways. Number one is we actually talk to the patient. How are you feeling? And we get a subjective sense of how the patient views their recovery. Are their headaches getting better? Do they feel like their activities of daily living have been impacted? Are they the same, better, or worse compared to their preoperative status? And that's very important. So those patient-reported outcome measures are extremely important to us. Does the patient feel like they've improved? But that's not the only thing that we track. We also track, very importantly, the biomedical markers. So the pituitary gland is the master gland for the human body, and it has very important endocrinological axes, and we track all of those. I am biased towards technology. So I believe that technology is going to, in the same way it has infiltrated our lives socially in this country, it is also going to start infiltrating us clinically. And so all the ways in which patients are tracked outside of the hospital, I believe we're going to start co-opting those same resources to track them clinically.
Patients are helping us track their improvements in ways that are important and meaningful to them. For example, a meaningful outcome might include whether a patient who has had what we would consider a successful back surgery, whether they can bend down, tie their shoes without feeling pain, or lie down without becoming short of breath, or feel well enough to go out and socialize. When we measure these kinds of outcomes, we can be more precise in figuring out how to improve that patient's quality of life. And not only that, over time, we build a very useful knowledge base that informs and improves our care for entire populations of patients. Historically, in healthcare, we've measured our performance by tracking things we want to avoid, like readmissions, mortality, and surgical errors. With PROMs, we're tracking the positive measures, meaningful outcomes like time to return to work, making this a routine part of the way we care for our patients.